Okay, guys, this could be bad. Top CDC doctor contradicts Trump and warns it's not a question of if, but when the coronavirus spreads to America. And she tells parents to prepare for school closures, teleschooling, and significant disruption in our lives. It's no longer a question of if, but when the coronavirus will spread in the U.S. centers, said the CDC. They said it Tuesday as they told parents to prepare their children for the possibility of school closures. The CDC said Americans may need to prepare for teleschooling should the virus continue to spread throughout the U.S. So far, 57 cases have been confirmed, 14 in the nation, 40 from citizens from the Diamond Princess cruise ship in Japan, and 3 evacuated from China. And though the threat is currently low, the Dr. Nancy from the CDC said the public needs to be ready if the virus becomes a pandemic. It's not so much of a question of if this will happen in this country anymore, but a question of when this will happen, she told reporters in a media call on Tuesday. We are asking the American public to prepare for the expectation that this might be bad. She's concerned that she suggests that parents call their children's schools and ask if there are plans for children to attend class over the internet or via video chat, should the buildings need to close. In fact, she told reporters she has already called her own children's school to ask how it would handle closures due to the outbreak. The doctor said although the threat of coronavirus in the U.S. is currently slim, the infection's international spread abroad makes containment at the U.S. border and within the nation increasingly difficult. Therefore, she suggested recommendations that the public could take if the virus reaches pandemic-like levels. There you go, guys. At a community level, this means reducing face-to-face contact in schools and officers and replacing in-person meetings with teleschooling and teleconferencing. I had a conversation with my family over breakfast this morning, and I told my children that while I didn't think we were at risk right now, we as a family need to be preparing for a significant disruption of our lives, the doctor said. That sounds like she's expecting it. She said she called her children's school and asked, already said that. Literature is also reporting about 100 or so pediatric cases. 80,000 people, more than 80,000 people have been infected with the COVID virus, the coronavirus. 2,700 people have died that we know. I think China is way more than that, guys. And that's just Jackie speaking. I don't have any stats, but what I'm hearing from people in China, it doesn't sound good. All right, guys. Dog's playing with a toy here, so if you're squeaking, that's what it is. The doctor gave a media call on test kits updates, some of which were flawed. Currently, 12 states and localities have working test kits, but it's unclear which states and cities have them. She said she's frustrated and had issues with the test. I want to assure you we're working to modify the kit and hope to send out a new version to state and local jurisdictions soon. She added that 400 samples were tested on the CDC at Monday night, and there are no backlog despite the defective test. Let's see. I'm sorry, I'm skipping stuff, guys, because I'm just reading it. Some of this just doesn't seem to matter after just hearing the facts right now. She says she and her colleagues are hopeful that the virus could be a seasonal illness and that is more virulent in the fall and winter, but there's no way of knowing right now. Now, President Trump is saying that the situation is very well under control in the U.S. and patients diagnosed with the virus were recovering. Meanwhile, the White House has requested $2.5 billion to fund better tracking of the virus, treatment development, and ramped up production of the stockpile of 300 million face masks and protective gear for U.S. healthcare workers. I'm deeply concerned that we're behind the 8 ball on this, said Senator Pat Murray, a Democrat from Washington. I don't know, guys. It says here that they've been having, U.S. officials have been conducting secret meetings with lawmakers and senators During the closed-door meeting, lawmakers were told there's a very strong chance of an extremely serious outbreak of the coronavirus here in the United States, a Democrat from Washington said during the hearing. They said the meeting was top secret, but claimed that ultimately nothing had come out in the briefing that hadn't been shared with the public. Like I said, I'm skipping. I'm sorry. You can read this article if you want to in full. Let's see. They're just talking about the masks and the money to get this stuff, and oh boy. And they need that $2.5 billion to cover the development of therapeutics, as the one entering clinical trials in Nebraska, which is my house, and vaccine as well as the protective gear for healthcare workers. I do have to say that Nebraska has really good. The facility that we have is really, really top notch, but that just means they're going to send more here. I don't know. So far, it has been proven less fatal, but perhaps more contagious than other viruses of the same family. Infection risk to the general public is still low. You know, you got to just believe what you want to believe. I'm just going to say, take care of yourselves. They're ordering masks and kits and all this stuff and telling you to find out if your school has, tele school. The first human clinical trials of an antiviral treatment for the coronavirus that sickened more than 80,000 people worldwide are set to begin in Nebraska, U.S. Department of Health and Human Services. Now, I just watched the news tonight, and they did speak to a doctor who has an injection that they're working on. It's not if I remember right, I'll have to get my facts straight, but I think it's not like a shot, like a flu shot, but it is an injection. I think it's to help once you get the symptoms. I don't think it's to prevent you from getting them. I'm not real sure. I will get back with you on that. It's a coronavirus vaccine, and we're going to start, in Nebraska, they're going to start the phase 1 clinical trials in humans. If a pandemic is coming and we're disregarding scientific evidence and we're relying on tweets and an emergency supplemental whatever without details, I just think this is not enough, said the Senator Murray. If you lowball something like this, you'll pay for it later. Very likely, if not inevitable, COVID-19 pandemic is what they're saying. And then they talk about Australia. Guys, just pray, okay? I did skip a lot. I just wanted to get to the basics. I'm a basics person, and then I'll go back and read the rest later. So have a great night.